Okay, welcome to this podcast. I've got Dr. Jess Armine with me today, which is really interesting. So he kind of comes from working, I guess, with patients that have complex chronic illnesses, people that have all sorts of problems whereby they've been to see other practitioners, they get no answers, and I guess they find their way to you in the end, effectively. And I know that some of the work that you do is really focused on long-COVID, which again has kind of touched everyone, I think, over the last sort of 4 or 5 years, really. So it'll be really interesting to get into that conversation as well as schizophrenia, which I know is something that's very dear to your heart. So welcome to the podcast. And
Thank you.
if you can give us your bio, that'd be a great place to start, Dr. Jess.
No problem. I've been a healthcare provider in one form or another for approximately 50 years. As a matter of fact, exactly 50 years. I started out as a EMT paramedic in New York City in 1975. I went to nursing school. I went to a college of nursing and graduated with a Bachelor of Science in 1978. Spent 4 years in the military as an Army nurse. Most of my concentration there was in critical care, emergency care, and being a paramedic in New York City, dodging bullets. Um,
Wow.
I the decided to go to medical school. I did all the prerequisites and realized that as I spoke to a lot of medical doctors that they disliked what they did. So I knew a lot of chiropractors and decided to go to chiropractic school. Graduated in 1986. I've been doing chiropractic since then. Did standard chiropractic for a while, but it was limiting for me. So I kind of expanded my knowledge in alternative medicine in various areas. And I'm making this very short. One of my children developed schizophrenia, which launched me into learning everything about that, all the imbalances and so forth, because the medicines they gave him made him a non-entity in my estimation. He's a very intelligent, very glib kid. He's 38 now, and has full-time work. He's a graphic artist. As a matter of fact, he created this logo for me.
Yeah, very cool.
Um, But in the meantime, I started treating people who had complex conditions that were told there was nothing wrong. And however that expressed, they were going through to one doctor to another, being shown that there was nothing wrong, nothing wrong, nothing wrong. It must be in your head. I started delving into that. I was at the beginning, the forefront of the genetic craze now. So I understand genetics very, very well. I understand a concept called neuroendoimmunology, the relationship between the nervous system, the immune system, and the hormone system, and the mitochondrial, the energy system, and how the cells actually heal themselves. So, believe it or not, there's a whole area there that no one was treating. They would treat if they knew the root causes, Lyme disease, whatever it happened to be, okay, or they would treat the end results. But people were being told that they had something that wasn't really a diagnosis. Like if you have OCD, that's not a diagnosis. That's a list of symptoms. A diagnosis would tell you why. If you have a sore throat, that's the symptom. If you have strep throat, now I know why. And I started learning about, I'm also a Reiki master. I started learning about the spiritual aspect of things. And where it really came together was in 2013, where Dr. Robert Navio, MD, PhD, wrote a paper on something called the cell danger response, which is how your cells respond to any kind of assault. And remember, everything happens at the cellular level. Because you put cells together, you get tissues. Tissues together, you get organs. Organs together, you get a body. So what happens, what things that can attack the cell are things like toxins, which you might expect, microbes, viruses, parasites, and so forth, and all the psychological, spiritual, and emotional traumas that we face will injure the cell in equal measure as the other things. Why is that important? Well, let's face it. We're spiritual beings having a human. One more time, Jess. I'm from Brooklyn. I talk too fast. I'm serious. I just babble along about, right? We are spiritual beings having a human experience. I'm sure we've all heard that term. What does it really mean? Well, our souls, our spirits, however the concept is, has to work its way through this physiology. So when you have an autistic kid, yeah, his brain's on fire, but if you want to fix that, put the fire out. It's not something that has to be put up with from now until forever. It's possible to do that. Yes, presently I'm working a lot on long COVID because I'm in the research groups. I know exactly how to treat something like that, how to take that spike protein from COVID, which is what's causing all the problems, tear it apart and remove it, okay, as part of a process. But remember, these things cause imbalance in your body, which can express as various symptoms, getting into the psychic area. I think I'm doing the whole podcast right now, right?
Exactly. Well, I think that's the whole thing, Jess, isn't it? Everything is kind of symptom based, really. And that's
Exactly.
kind of that's kind of where the medical profession has been built and set up, is to look at a symptom and then find a treatment for that symptom, but not really to connect symptoms together and look at things in a kind of non-pharmaceutical way, really. And I think that's where we are as a society now, and we're evolving to the point that we understand, as you said, that there is a spiritual component, and that spiritual
Hmm.
component doesn't really come into play really currently, but things can happen to us, emotional trauma. I mean, things you must have seen, working in the military and as a kind of paramedic in New York. I mean, traumatic things that you see that affect you, and that changes your frequency, changes your vibration, and opens your field up to other things as well, I guess.
The thing that started interesting me in this area was there are people who have done everything, gone to the more esoteric disciplines, and really flourished. And then there were people who were doing that and they weren't flourishing. Where was the problem? Okay. And here's what I perceive the problem to be. When I treat somebody, because of the way Western medicine works, we are trained to be symptom oriented, okay, and have the pill for the ill. Now, remember, your medical doctors are not stupid and they do care, but they are constrained. I saw this happen in the 70s, how it changed over from family centered medicine to specialties. And everything was an algorithm that led to a diagnosis, which led to a pharmaceutical protocol. Those were suggestions. Didn't take long for those suggestions to be standards of care. What does that mean? If you break a standard of care, you've committed malpractice. So they become more narrow, like this. They have to focus this way. And then when medicine became corporatized, they want productivity. So your doctor wasn't going to spend an hour with you because they weren't allowed to. 15 minutes was a lot. And when you do that, you can only follow an algorithm that leads to a pharmaceutical protocol. Then another layer on that is that you had to be tested. And if the test didn't point to the diagnosis, then you weren't allowed to treat it. So you know how long you can have low thyroid before it shows up on a test? Years. Okay. And you'll have all those symptoms until it actually shows up. And what will they treat? They'll treat the fatigue. They'll treat the fibromyalgia. Not because they're stupid, because that's the way they've been taught. So I see people come in with all this stuff and I say, where's the glitch? Yes, it can be a psychological or spiritual glitch, or it can be because the proper physiology wasn't treated. The body's kind of a webby thing. Okay, it's intricately simple and simply intricate. So when you think about something that's being psychological or spiritual, let's talk intrusive thoughts, anxiety, brain fog, fatigue. I'm very attuned to intrusive thoughts because that's when you go from a mood disorder to a thought disorder, and it's all based on dopamine. That's how it expresses in our body. That can have lots of origins, but it expresses in our body by higher dopamine. Can I see the genetic predisposition to that? Absolutely. I can look at somebody's genetic pathway and say, they're not going to break down dopamine very well. This is the way it works. Very simply, dopamine becomes norepinephrine, noradrenaline, and then adrenaline, then it works its way out. So somebody, if there's a glitch in that pathway and there's stimulation to create a lot of dopamine, the dopamine will rise. Now, as soon as it gets a little high, you can have anxiety disorders, OCD, ODD, oppositional defiance disorder, and all the excitatory disorders and that kind of stuff. As it goes a little higher, that's when you start getting into the thought disorders. Schizophrenia, intrusive thoughts, intrusive people screaming at you. Go a little higher than that, you have autism. The true autistics, those kids that are walking around like this that aren't of this earth, they can't form thoughts. Now, you can have somebody at the lower end of that, okay, and they are excitable, but they can't focus on a thing. Okay? They're like that dog in the movie, I think it was Up, squirrel, they get easily distracted. Why? Dopamine gets converted to noradrenaline. Noradrenaline is what you need for focus. High this, low that. Okay? And that's why with ADD, without consideration of everything else, they'll give somebody amphetamines. And sometimes it works, and sometimes it doesn't. Why does it work? Because that happens to be the problem. Lack of noradrenaline. When it doesn't work, it means you've got inflammation here for another reason, and all you can do is blow the back of the person's head off by making them more excitable. So when I look at somebody who has, if you will, neuropsychiatric illnesses or spiritual dysregulation, I listen to their history. By the way, that's how you figure anything out. Okay, I listen to their history and assess what's worked, what hasn't, what course they've been on. So I know where to start intervening. And of course, I have people I refer to certain conditions or certain treatments that I know who do things better than I do. If there was a woman who has been sexually assaulted, I know one of the ways of treating that would be something called EMDR, that type of therapy. I don't do it myself. I know that all this stuff, that kind of trauma, because of that cell danger response, will cause disruption in the cell over time. And even if you take care of the psychic portion, the cell damage will remain. You have to treat that too. Okay? Often, all we've done is try and treat the cell. Well, most people don't treat the cell. They try and treat the alleged condition and ignore the manifestation. Is it from this to that? Is it from the cell to the psychological, from the psychological to the cell? It can work both ways. Fact is, it's there. And I have a lot of people who are doing a lot of work, and I have to turn them on to that concept. And that's the way I do it. I show them what intrusive cellular. See, we talked about this. Yeah, well, guess what? You have to deal with that. You have to, and however you want to deal with it. It's bad that people in your area have been denigrated, relegated to woo-woo by the Western medicine. One, because they're arrogant sometimes, okay? And two, they don't understand. They simply don't understand. And their version of treating spirit and psychological stuff is to send them more to the psychiatrist for what? More medicines. The medicines don't change this. They change the function of the receptors so that either you're trying to prevent reuptake of serotonin or whatever it happens to be, it's working on the receptors. And let's talk SSRI for depression. Excuse me. SSRI means serotonin reuptake inhibitor, which means that when serotonin is released in the nerve into that synapse to carry a message across, when it finishes doing that, it can hang out with its buddies, get broken down, or it gets reabsorbed, reuptake. So if we're not having enough of this in here, they say, we need more. So they prevent some of the reuptake. Okay, so it works out for a while. But there's going to be a time when you don't have any, and it doesn't matter, the medicine will fail. What they forget is that you have to deal with the production of it. That's purely a physiological problem that can express as a spiritual problem. And sometimes that pathway to a spiritual problem becomes embedded, if you will. It does it in the nervous system too. So if you don't take care of that area, you can tell by the degree somebody's expressing in a certain area, okay, of what needs to be treated. If you don't look at it holistically, and when I say holistically, I don't mean swinging a dead chicken over somebody's head or using crystals. Not that swinging the chicken is one thing. Crystals are good, okay, especially when I do them. Okay, there's many methods of healing. No one method's got it down. Okay, it's the person's response to it and what is better for them. And being a holistic practitioner for a long time, I have a little bit of a jump where I can sit there and say, I've seen this before. Let's try that. Okay. And you have to just be willing to work at it. But all of this stuff has a physiologic component and needs to be folded in to almost any illness, psychic, spiritual, or physical. They're going to all be together. Okay. Especially once you start becoming ill from it. Is it bad to work with, you know, spiritual stuff? No. And I'm not here to argue those experiences. What I'm saying is, if your nervous system is dysregulated, if your immune system is dysregulated, and if your mitochondria don't work, you're going to start getting things like intrusive thoughts, having sensations, sometimes depersonalization, where you look like you're on the outside looking in. And everybody banters around mitochondrial dysfunction. What is that? Well, those are the little energy producing mechanisms in your cells. Remember being in school, the teacher would draw a circle. This is the nucleus. Your old dust, that's cytoplasm. And they have these vacuoles that gets rid of the waste. And they drew this little thing look like a racetrack. That's the mitochondria. Okay. They bolt it out. Well, we need energy. And if we don't have energy or not enough, we're not only not going to heal, we're not going to correct those imbalances that may express psychically, because the spirit wants to work through our bodies. And if it can't because there's dysfunction in the body, you're going to have some kind of backup, some kind of, bad thing happening. Your mitochondria produce energy. It's called ATP. Don't worry about the letters. Give you the picture of the enormity of the problem. You have 30 trillion cells and anywhere from 200 to 2,000 mitochondria per cell. You do the math. So you don't, mitochondrial function is not on or off. It's percentage. So let's say normal for you is 95% output. You get an acute illness or any kind of attack, it may go down to 85 or 80%. As soon as that resolves, it goes back to 95%. But when you have several things going on, some toxins, we live in a toxic environment. Okay, so we can't get around that. Well, you can, but do your best. Or chronic microbial exposure, chronic Lyme disease, chronic EBV, chronic yeast. So many people have candida don't know it. And you start putting in all those psychological, spiritual, and emotional traumas, guess what's going to happen? You'll be running at about 80, 75, 70%. And that's when you start seeing brain fog, chronic fatigue, chronic fibromyalgia, and so forth. With COVID, the bad thing about COVID was it has something called a spike protein release. And those spike proteins are actually toxins. And they occupy the ACE2 receptors, which are all over your body, which degraded mitochondrial function even further. So those people who got COVID or got the jabs or got it by shedding, who were ill before and became more ill, if you will, if that's English. Okay,
Sounds good to
became more
me.
ill. Okay. And never got back to their baseline. Okay. That's the reason there was a spike protein degrading the mitochondrial function even further. If you weren't ill and you got ill and you never came back to yourself, and that can be physical or psychological or spiritual, okay, it's a spike protein.
It's
And we have
actually
a
probably,
very,
Dr. Jess, it's probably most people I know that have had COVID or had the jabs, obviously, never really have come back to where they were before for different reasons. And
exactly,
obviously, there's different people like Dr. Brian Ardis that talk about the ACE receptor and how nicotine sits on that cell. And if
yeah.
you kick off the COVID um, off that receptor, then that clears a lot of that. So is that where you are? Are you looking at those receptors, the whole nicotine thing? Is that part of?
Well, the understanding the function of the spike protein and its physiology and how all that stuff works, I went through all the various ways that you can kick it off the receptors. Nicotine was one of them. It was very incomplete. You can use various enzymes like nattokinase and so forth, bromelain. That helps too. Sometimes in combination it helps. And then I ran into something called augmented NAC, which is N-acetylcysteine. N-acetylcysteine itself will denature or, break apart the spike protein and pull it off the receptors, as well as creating more glutathione, which is your master antioxidant, which is now going to scarf up all that oxidative stress and inflammation and help your detoxification pathways. And very interestingly, glutamate, which is an excitotoxin, it's a neurotransmitter, which in very high levels will give you psychic disease. Okay, it'll also give you seizures. It binds with that to create glutathione. The augmented NAC is higher in bioenergetic coherence, which is also quantum coherence. So where 100 milligrams of the augmented NAC would equal about 2,600 milligrams of the standard. They did studies in actual tissues that had COVID, and they found out that the standard NAC in 24 hours would degrade, if you will, about 18%. That's probably a little high. Whereas the augmented NAC did 99%. So I was convinced to try it with my practice. Okay. And I found people who were stuck, who just weren't getting better, started getting better rapidly. And to me, it was important to know that these were the people who were ill for a long time, and especially those, as you described, who got dysregulated or sick or not themselves after COVID, and never got back to normal. They got back to normal then. Okay. So it was a pretty good logical conclusion that it was from the spike protein and from this particular product as opposed to combinations of others. Is it bad to take the other ones? No. Okay. I'm just telling you which ones work better. I recently published a paper about 6 months ago on post-viral syndromes and long COVID and how to treat it. And it was a scientifically oriented paper. It was published in a scientific peer-reviewed journal. And we're comparing it so that people need to know that long COVID is not a thing that has to be tolerated. Because what's happening now? Don't tell anybody. Okay? Yeah, I joke around all the time. Listen, guys, I've been in practice a long time. Disease to me is a bully. And the bully, either you hit it in the nose or you laugh at it to take away its power. I laugh at it. Okay? That's just what I do. So don't take offense at it. I'm not being condescending to anyone. Because guess what? You're not going to be impressed that I can pronounce polysyllabic terms. Let's get this concept together. But here's a reality. They're allowing long COVID to be the next illness that has no cure, that we're going to manage. Chronic Lyme disease, which they kind of try to, hold down because they'd rather treat the fibromyalgia, they'd rather treat the downstream effects with expensive medicines. So people say, "Oh, that's not true. That's not true." And I said, well, let me ask you something. Is there more money in treating diabetes or curing diabetes? Is there more money in treating cancer or curing cancer? So where do you think the research is going? Well, we have a lot of chronic illnesses now that we never had a long time ago. Have they been allowed to happen? I'm not being conspiracy-wise. Have they been allowed to happen so that you can manage it? Or are we really aggressively going after the reasons? Okay. And remember, the initiation of those diseases can be toxic, metabolic, or psychological, spiritual. Okay. That's been proven scientifically. There's no question about it anymore. So when I think about long COVID, okay, I try to pick the thing that will get people from A to B the quickest and what has the best efficacy and what I have experience with. When I can put all those together and my insights, my intuition says, go for it, that's what I do. Plus, it's something called a risk-benefit factor. If what I'm doing has very little or no risk and a great probability of benefit, if you do you have medication commercials on your TV over in the UK?
No. No.
Okay, over here we do. Okay.
Yeah, yeah.
And if you look at these things, they have these various and sundry commercials for medications. Not that you can buy them, but you can tell your doctor to prescribe them.
Yeah,
I
right.
always tell my patients, close your eyes. Why? Listen. Because what you're seeing is this person, who's had rheumatoid arthritis, that's, got the white dress on, jumping through the field, right? And they're telling you, this can kill you. This is going to give you all kinds of infections. If you have tuberculosis, you might as well give up the ghost. I mean, you listen to it. People have died during the trial phases. People have died. Oh, they take that. All right. They have to tell you. but they
Yeah,
tell you
right.
in such a way that it doesn't register. Okay. So what does this all happen? Why is the spike protein so important? Its relationship to mitochondrial function. If we can pull that off the receptors and break it apart, which is what has to be done, okay, you just can't pull it off the receptors and let it run around, then its effect and the mitochondria will just bounce back. You also have to give the body what it needs to work. It is a holistic system, but if we leave the body dysregulated, it's kind of hard to tell, you know, if the low vibration, the energetic interference, or the feeling of spiritual attachment is fully those things or fully biophysiological or a combination of both. That's why people like you and I working together is probably one of the best things that people can do because being professionals, we are able to. I gotta stop my Brooklynese, man. Okay.
It's fine with me.
Seriously. I've been talking all week. I feel like I have peanut butter in my mouth. But anyway, we'll be able to differentiate. Differentiation doesn't mean you're excluded from something, but it's putting everything together to say what's best for your individuality. And if you trust your provider and you work with people, you know who's going to have your best interest at heart. I don't have my own vitamin line for that reason.
Yeah,
I
right.
can,
I was about to ask you actually if you actually have like the same protocol that you use for people that have long COVID, or do you look at do you do blood work and
everything.
that kind of thing? So you're looking at the whole holistic picture, really.
Mhm.
Yeah.
I take, Sir William Osler, who was the founding father of one of the founding fathers of Johns Hopkins here, big hospital, said, listen to your patient. He's giving you the diagnosis. He said that in 1895. And that's what we've lost. Because if I want to figure out what's wrong with someone, I will sit down for an hour and a half. I will take their entire history. I will go over, and usually they've given me all their lab work and stuff. I've gone over it previously, but I give them what I like to call a de novo hearing, which in legal sense means a new hearing without prejudice. In other words, you don't prejudice your mind. You look at everything fresh. And that's exactly what I do. And I've been doing it for many, many years, so I'm pretty good at it. Yeah, in other words, separating what I see on the lab test and listen to it fresh. I don't look at that person saying, "Oh, you got this case, you got that," before I even see them. I'll take their entire history from in utero forward. I'll see where the baselines are. I'll see where the deviations were. Then I'll start correlating their symptoms, their history, and their lab testing. And like you said, it's really easy. You can see somebody's, was going along. Maybe they had these kind of problems, and then COVID hit. You know, okay. Or the hardest thing to diagnose empirically is breast implant illness, which is ignored.
Okay, that's
Because
interesting.
women, yeah, they get the implants, even if they're the saline ones, and the symptoms don't show up for 5 or 6 years.
Yeah, right.
And I think in England they have what are called gummies, which are silicone implants that are solid, pure silicone. Okay, put in
Right.
the body, the immune system goes nuts.
Yeah, of course. Yeah,
You'll
it's
have
a
symptoms
foreign body,
earlier.
isn't it? In the inside, which is what
Exactly,
it's going to try and
exactly.
push out, obviously.
Yeah, and the whole thing is that if you listen and you sit there and go, gee, wonder where the deviation was. And then when nothing's there and you see, okay, this is when they had the implant, you say, okay, you remember what Holmes always said. When you rule out the impossible, whatever's left, however improbable, must be the truth. So you go back to that because there's no tests for breast implant illness per se, but there's inflammatory tests if you need to test.
And what does
Okay.
that look like, Jess? So breast implant illness, is that fatigue, tiredness? How does that kind of
Oh,
manifest, really?
well, it come it
Because I've not heard of it actually, so it's a new one on me.
okay. It's something that is really knocked down or pushed down in the UK. Here in America, it's rising in people at least considering it. What it's going to look like is everything that you don't think it is: rheumatoid arthritis,
Right.
Hashimoto's thyroiditis, anything that can happen from inflammation. I have thermograms. of women who've had implants, and you can see the red all over the place,
Right.
indicating all kinds of inflammation. And then after explantation, okay, it resolves within like a month or so.
Wow.
I know of a practitioner who went from doctor to doctor with neuropsychiatric complaints, gastrointestinal complaints, genitourinary complaints, the whole gamut, and was had one test after another after another. It must be in your head. Until she pushed about it, they got the thermograms, which is not a non-standard test, but it was right there. She found the doctor who would do the proper explantation, did the thermograms again, and started calming down. And then all those other symptoms, all those other conditions started reversing. All those conditions that they were told are permanent, and they're not. Okay? They're a result of chronic inflammation. So, however, chronic inflammation, oxidative stress, same terms, how that would express is what you would see. How do you know it's that? Because you've had tests for everything else and they keep telling you it's in your head.
Yeah, right. So you rule out everything else
Okay.
basically, which then leaves that focus. Yeah.
Sadly, it's a diagnosis of exclusion. Okay, but if if your provider or you're not if you're not even asking if you don't think it can exist, you can't diagnose something unless you know it exists. Okay, if you don't know, and this is not controversy. This is just I don't know why in medicine or anywhere else, the politics they suppress certain things. I can get cynical about it, but the fact is, it's there. It's provable. Okay. The long COVID, the testing they're doing is antibody testing. Not exactly accurate, but it helps. Um, because if your immune system's on the low side anyway, it's not going to react as much to whatever's, you're not going to see the antibodies or they're
Yeah,
going to
right.
go below a level. When you read a test, when you're doing a test, it's always the normal range or the average range. If your number is at the lower part or at the lower part of the normal range or below the normal range, it's going to be read as negative. But you shouldn't have any antibodies to that at all. There's a certain threshold that reflexes a positive response.
So
How
what would
accurate
you
is that?
say in terms of sort of numbers or percentage? How many people do you think actually have long COVID in society now? Are we talking like 50% or 90%? Because most people I know have had COVID. Most people I know have had the jabs of COVID. I didn't personally, but I had a bit of a heads up from Chen, my spirit guide, basically, of course. But a lot of people that did have done that went down that route for whatever reason that have had problems. So what where do you think those sort of numbers fall into?
Well, I will tell you that it should be presumed that everybody's been exposed to the spike protein
Yeah, right.
for a couple of reasons. Number one, either the jabs, and people have had multiple ones, which, by the way, you were going on, don't beat yourself up. You were going on the best information at the time.
Mm,
And believe me when I tell you, they used all kinds of scare tactics. Nevertheless, people who actually had COVID and people who had COVID, even if you didn't have symptoms by shedding, sneezing, sexual transmission, families. Let's face it, you eat together. You're here, have some of mine. It's normal stuff. The variants that occurred, which they made everybody scared. Viruses are supposed to mutate. They usually mutate to a lesser dangerous form because they don't want to kill their host either.
yeah,
Okay.
right. Yeah.
And when you get a flu vaccine, it's yet last year's flu. Why would we do that? Well, when you have a whole, let's call it a whole cell or a whole, microorganism vaccine, and the immune system looks at the whole genome and goes, okay, I'll get you when I see you again. But not only that, I'm going to get your mother, your father, brothers and sisters, and your first cousins. I'll recognize them too. Okay. So basically, we have partial protection. What they did with these vaccines was, let's have them look at just that part of the genome. So yeah, when I saw that, got it. But variations happen, mutations happen. Didn't recognize the mutations. Okay. And that's we'll have no, don't worry, we'll have more vaccines. They kept scaring people until people finally got annoyed with it and they stopped. By the way, that's when all those studies came out. They knew about this beforehand. The studies came out very quickly about the effect of COVID on, and they called it post-viral syndrome, things that weren't going away. How many people have it? In my practice, it's got to be 75%
Right. Right.
as a contributing, either primary or contributing factor. That's the trick. I wouldn't go around yelling long COVID about everything because it's very hard to diagnose it. But almost everybody that I treat gets treated for the spike protein because my treatment also includes, with that one product, the thing I tend to use, is to increase their glutathione, which increases their ability to fight all kinds of oxidative stress and all kinds of inflammation. Most people who have any kind of excitatory disorder, glutamate is usually involved, okay, and that will bind it and regulate it normally. So it regulates the glutamate and improves your detoxification. You can't go wrong. I'm treating several things at once. The diagnosis of long COVID, I do by history. Like I told you, somebody never got back to normal. They're only now coming out with a test called the urine spike tracing, which actually looks for fragments of the spike protein in the urine. And
Okay.
in my estimation, that's more accurate. Okay, but it's only, I think it's available in Italy right now and America, just started in America. Okay, they tried, as far as I know, they tried to get it in England, but getting the urine from England to Milano, customs held it up too long. Okay, they couldn't get it passed quick enough. And there wasn't a lab in England that could, do their needs. But history is just fine, especially if you're treating in a way that does not endanger you at all and can only help.
Well, that's the thing. Your method is supporting the whole body regulation of the immune system, which is what we all have. That's the whole point, really.
Right.
And that was one of the things that my spirit guide Chen always kind of says to me, really, is that humans were designed for everything to go in the mouth and be processed by the digestive system. So anything that's coming into a vein that's IV is bypassing our kind of protective system, really, to a certain degree. I know that can work obviously as well, but generally, if it's going in the mouth, it's kind of by design. If it's not, it's kind of not really. So it's an interesting kind of way to look at it effectively.
Most of your immune system is right around the entire gastrointestinal system.
Yeah.
That's why we talk about leaky gut syndrome, where those antigens that you're taking in can get through the gut and be acted upon by your immune system. The result of that, with all those antibodies, that's where inflammation comes from. Okay. Yes, if we put something in our bodies that inherently will cause problems, sometimes it's not the microorganism itself of the virus, it's what it's in. Aluminum, formaldehyde, polyethylene glycol, okay,
Mm.
PEG, which you guys take as Movicol and we take as Miralax. Okay, that is a derivative of antifreeze. The
Right.
chemistry is there. Why we're allowed to use it as a supplement, as a thing that you can put in your body? Why do people react to it? Well, you don't know it's in your foods. It's what keeps your foods moist. It's on the label. Look for it. Okay.
It works
People
well in
go,
the car, not quite so good in your body.
exactly. And you start getting this, low doses, you start getting you don't get reactions, but you get that buildup of these things called memory cells. Then as soon as you got to buy injections, it's like, oh my God, it's like, yeah, this massive reaction. Okay. But even with children, who get vaccinated, it's not the individual vaccination, it's the group of them. This I've
Yeah.
noticed because I treat a lot of autistic kids. It's getting vaccinations while they're neonates, before they leave the hospital, and then getting 6 vaccinations at once. Some of my autistic parents of autistic children, their first one, they were fighting all these problems. And then when they have another one, they've worked out with their primary physician to spread the immunizations out.
Right.
And the second one does not have autism. And guess what? I've read the genetic charts. They're the same. Not necessarily twins, but they have the same groupings of problems. So that, remember, with genetics, it's not a matter of the genes, it's a matter of how much traffic is getting through. Genes create enzymes. Enzymes are how your body does things. Changes one thing to another, to another, to another, until it turns it into something your body can use. Think of it as a roadway. think of the normal pathway as being an 8-lane highway, or what do you call it, an M road? Okay, M road. Okay. All right. And the middle guy, heterozygous, is working about 60%. That would be like a 4-lane highway. And the worst kind, called the homozygous, is working like a 2-lane highway, sort of like your C roads. And I've been on your C roads. That's craziness. It's one lane. You guys come at each other, and you're coming at each other, like, right? I'm like, stop. You have T, decide who's going to go first. No problem. Okay. At least we're polite about it. But I'm an American. I almost hit everybody when I'm there. I have to keep telling myself, stay on the left.
Yeah, of course. Yeah.
I almost got hit by a car the first time I was there because I'm looking in the wrong direction when I'm crossing. I'm like, what are you doing over there? Yeah,
We have the same problem when we come to you.
right, exactly. So it makes sense that if you have a lot of traffic, the 2-lane highway is going to get blocked up faster than a 4-lane highway. And the 4-lane highway can get blocked up, but can you have enough traffic to block up an 8-lane highway? Yeah, you can. Okay. Yeah, I know. I've been in England on those nice big M roads, and rush hour. Rush hour is the same there as it is here. You're just going to
Yeah.
sit there. All right. It's all a matter of volume. What's the traffic? Oxidative stress. Okay. The accumulation of all the inflammatory factors. That's what makes your body not work, not your genes. Okay. Your genes were there since you were born. Unless you were sick as a baby, the accumulation of toxins, the accumulation of damage that has happened over time, okay, plus any acute stuff that's going on, like COVID and so forth, combines to make a ton of oxidative stress, which now allows the pathways that aren't working, that are shorter or thinner than normal, express, and that's where you start seeing the pathology. That's why it's different in all people, because you're a supreme individual. And those, what are called polymorphic pathways, can express only when there's a lot of oxidative stress. So your target of any kind of treatment is to reduce that.
Well, I guess that's the detoxification conversation, is it? It's
Or-
to detox, lymphatic system and try to get a lot of the heavy metals and those sorts of things out.
Absolutely. And, you know, we went to specialties, medicine went to specialties, which has its detriments because you go from one specialist to another to another. And at least here in America, the onus of diagnosis is on the person least trained to do it, and that's the patient themselves. Where we used to have real GPs way back in the 60s who knew you since you were born,
Yeah,
knew your
right.
family, knew everything about you, so they knew when something happened kind of where it came from. Okay, and if you had to go to a specialist, they'd send you to a specialist. The specialist would barely talk to you and say, I'll call your doctor. Would call your doctor, they would discuss it, and your doctor would call you and say, this is what I think we should do. And that's who you listen to. It's not true anymore. So the alternative medicine types, naturopaths, so forth and so on, like myself. I'm not a naturopath, but I'm in that realm. What we call functional medicine now.
Yeah, I was going to say, where do you actually classify yourself? Because you're covering quite a few different areas
Right.
topically, aren't you, really?
Well, you know why? Because that person who's the old GP, the real GP, doesn't exist anymore. And your old GP knew everything. You know why? Because they had this eclectic training, which was ostracized because you weren't a specialist. Well, guess what? You need somebody like that. And that's the way I teach a lot of courses. This is what I'm teaching. We have to take the responsibility. We have to pick up that gauntlet now. The sad thing is, as soon as I tell somebody I'm a doctor, they say, what is your specialty? I have some trite answers for that, by the way. But what happened in alternative medicine is they did the same thing. They started concentrating on hormones. They started concentrating on this or that. Well, let's face it, people, if all you have is a hammer, everything looks like a nail. Okay? You fit people into your paradigm. That's the wrong way to do it. Yes, what I do is all over the place. I had a business manager one time. He says, I can't work with you. I said, why? You're multi-passionate. I'm like, yeah, I'm Sicilian. What's your problem? Okay. I do too many things. I like too many things. I like putting it together. He would rather work with somebody who is one thing that they're going for, their niche. I got loads of niches. Okay, got loads of nephews. They're men of me. But seriously, you need somebody to at least look at you from that point of view for the whole person. In order to, and the way to do that is that's where the history comes in. Because since I don't know you from birth, I have to regain that knowledge and see where the glitches are. Put that together with your present condition, put that together with the environment where you live and what you do. And you can start coming up with answers, but the basic answer is to get the cells working. Okay. So always remember, guys, that what you're experiencing is real. Absolutely. No question. Okay. And if you haven't considered a physiologic component, you should. And if you're just entering this realm and you've done everything in the medicine and alternative medicine realm, you're on the right track because this is probably the stone that's been left unturned. Okay. It's tough though. There's a lot of stuff out there that expresses many different ways and can create conditions that you think are neuropsychiatric or psychiatric or spiritual. But always remember that your spirit has to work through this body. It doesn't have a choice. Okay. Yes, you can use energy work to help heal or to heal completely, depending on the circumstance. Okay. And sometimes all you can do is do it and see if it helps. Trial and error. There are no dipsticks in the world that you can go, oh, this is what you need.
Perfect. I think that's quite a nice way to sort of frame the end of the chat, really, Jess. So in terms of how do people get hold of you? Where is your kind of social media presence, websites, contact details, email, and
Well,
the training, the courses sound really interesting. So can you
mhm,
just kind of give us that picture when somebody
no
thinks
problem.
Jess is the man? I'm going to give him a
Okay.
quick ping. How do I get hold of Jess, basically?
You can ping me anytime. What's there and go? What do you want? Okay. No, seriously. If you want to know a little bit more about me, you can go to drjessarmine.com. Okay. There will be a button on the bottom that will give you an opportunity to do what I call a get acquainted session, which is a 30-minute session where we can get together, chat, and I can tell you right to your face. In other words, we chat for a little while, get to know one another, tell me a little about what's going on, and I can determine whether it's in my wheelhouse or not. Okay. And often, if it's not, and then you haven't done something, I can point you in the right direction. Okay. We also want to know if we're going to get along because it's a relationship we created. I'm serious.
Yeah, no, it's true. It's very true. Yeah, yeah.
I don't have a high volume practice. I don't take a lot of people, not because I'm smug, but because I'm 70 years old. And guess what? I teach, I do this, I do that, but the people I take are usually very, very difficult. And the ones that I feel in my heart that I can help the most. On Instagram, okay, it's Dr. Jess Armine with 724 at the end. That's my birthday, 724. Okay, that's Instagram. If you want to learn a lot of stuff, I've done videos like crazy over the years. Go to my YouTube channel, which is just Dr. Jess Armine. Okay. And if you want to email me to ask a question, it's just jess@drjessarmine.com. Okay. Real easy. Um, I'm a
And
nice
do
guy.
you work online with clients as well, Jess, or is it only in person? How do you?
I only work online. I have a
Right.
worldwide
Okay.
practice.
Yeah. Right.
Okay. I have patients everywhere, from down in Australia up to Japan. They're tough. Okay. And anywhere in between. I work out of my house. Okay. I don't have a brick and mortar. I have a brick and mortar office, but I work out of my
Yeah.
house and I work totally virtually, and I'm set up to treat anybody around the world. If you do look to have a session with me and you can't find a place, just email me because it may be a distance problem and I'll manually schedule you.
Perfect. That's wonderful. Well, thanks very much for your wisdom. It's been very interesting. I've learned a ton. I need to go and do some research myself now. Now we've had this chat. So I think anyone that's suffering with long COVID, because there are so many people that are still in that COVID world, really.
Yeah,
Obviously, Dr. Jess is a first port of call, really, to have that conversation. I think it was really inspirational to hear that that is very fixable for everyone, really.
it
And I
is
know
very much so.
many people that I can see
Yeah.
in your direction, really. So that'll be good.
And what's necessary to treat it is available in the UK.
Yeah, perfect.
Okay, because I have a lot of patients in the UK and I'm really happy I don't have to like sneakily, ship it over.
Wonderful. Okay, Jess, well, thanks very much. And I'm sure we'll
Thank
probably
you.
catch up again at some point and have a chat. And obviously, we'll catch up offline.
Take care now.
Okay, thanks for joining.